Ian, what is Sculptra and JULÄINE?
So both Sculptra and JULÄINE are injectable products. They are injectable regenerative products that can stimulate collagen and elastin in the tissues. They both are based on a material called poly-LL lactic acid, or PLLA. And they both are very similar in lots of respects, but there are some significant differences between both of them.
How do both Sculptra and JULÄINE work then?
So both Sculptra and JULÄINE work by the compound that we're injecting, which is PLLA, and in JULÄINE's case, it's a new form of PLLA, Elastin Pro. But both of them will slowly release lactate into the tissues. Now, you may have heard of lactic acid in our body. So our body will produce lactate or lactic acid when we're actually exercising, and it produces lactate, which then becomes lactic acid. So our muscles produce a lot of lactate, which becomes lactic acid when we exercise. Now, what is the role of lactate in our body? Well, it's a signaling chemical. It goes around the body, even in the brain. So we know that it will stimulate new muscle growth. So that's why we exercise, and how our muscles rebuild and repair, and maybe even grow if we're doing weight training through this lactate mechanism. We know that everywhere that lactate goes in the body, it will have a signaling, stimulatory, regenerative or rebuilding capacity. Even in the brain, we know it goes to the brain and stimulates the brain neurotrophic growth factors to help the brain work, which is why exercise is so good to prevent dementia. But when we're injecting this product, we're releasing lactate, or it is releasing lactate in a very slow, controlled way into the tissues. And specifically, when we've injected it into the skin and the subdermal part of the skin, it will stimulate the cells called fibroblasts, which are the cells that produce collagen and, more importantly, elastin. So as we're aging, we're losing collagen, we're losing elastin, our skin is changing, it's becoming looser, we're getting that elasticity loss, we're getting maybe the development of the jowls and the nasolabial folds or lines and wrinkles, all due to collagen loss and elastin loss. So this product is helping to regenerate new collagen, to regenerate elastin. Both of these products are very good at doing this. We also know that actually lactate can stimulate the production of new fat, adipocyte cells, which are the cells that which are fat cells. So again, if we're losing volume in the face, especially from loss of fat, which happens with the aging process, or even a lot of weight loss, then we can stimulate some new fat to come back. So it's a really exciting product. We even know that lactate and this product could even stimulate muscle repair and muscle growth. So it has a wide variety, a range of uses, both of these products. And this is what's really exciting about using them.
Ian, how is Sculptra different to JULÄINE?
So as I said, how is JULÄINE different to Sculptra? Well, Sculptra has been around for a very long time, and the PLLA particles in Sculptra are crystals. Unfortunately, this is how they come out. Now, we know that crystals are irregular particles, different shapes and sizes. Now, they all start off as tiny particles, around about 50 microns. So you need a microscope to see these particles. But the problem with crystals is they can have a positive or negative charge, and they can aggregate together. They attract each other. So these particles can come together and become bigger particles. And the problem there with Sculptra is that if that happens, then not only are we getting the benefits of the lactate coming out of that product as it slowly breaks down and dissolves, but those bigger particles that come together in the tissues can cause inflammation. And the problem is, if we produce inflammation, we stimulate the wrong collagen pathways. We stimulate the effectively scar tissue type collagen to be produced. So we can end up with maybe even a stiffening of the tissues, or what often that we can see with Sculptra are little nodules or lumps in areas beneath the skin or within the skin. Now, with JULÄINE, it's very different, because they found a way of manufacturing the PLLA into absolutely perfect microspheres, perfect little balls or spheres that are all, again, 50 microns roughly in size. So they're not big enough to cause inflammation, and not small enough to be sort of taken away by the body's cells, the immune system. So these little microparticles, these microspheres, stay permanently for several years as they're breaking down, or stay for several years anyway, slowly releasing the lactate, which is, as I say, that signaling chemical that stimulates the collagen, the elastin, and the changes within our tissues. So in that way, it's very important because these little microspheres do not have different charges, so therefore they don't attract each other. In fact, we know from science, as it has been shown, that they actually repel each other, and that's really important. So there's very little chance of these particles coming together and therefore causing inflammation. And so the risk of nodules, the risk of lumps, inflammation, scar tissue changes and stiffening of the tissues is incredibly low with JULÄINE. And this is called elastin Pro technology of the PLLA. And that's what makes, for me, JULÄINE a really exciting product, because it means we can use it with a much greater safety record and not risk lumps, bumps, nodules, stiffening the tissue. We can use it pretty much anywhere on the face and body for that reason.
How are the treatments undertaken?
So both Sculptra and JULÄINE treatments are relatively simple. We normally inject them with a cannula, or that's a little blunt tube. So we're placing that product very safely, very atraumatically underneath the skin and beneath the surface of the skin and into the fat compartments or deeper. And the product is reconstituted with saline, which is a sterile water effectively, and it's injected very simply. It's slightly easier with JULÄINE to inject than it is with Sculptra. We often find that Sculptra can sometimes block the cannula because the particles come together and get bigger, even as we're injecting it. But relatively speaking, they're very simple atraumatic treatments, and most people find the treatment very, very simple and a simple injectable procedure, really.
Why is the aftercare different for Sculptra compared to JULÄINE?
This is a really important point about the aftercare, because as I've said in previous comments, Sculptra has these irregular particles, irregular shaped and sometimes sharp particles that come together and can then aggregate and become bigger particles, which can lead to inflammation in the tissues. We don't want inflammation because that produces the wrong collagen, can create lumps and bumps. And the importance really after a Sculptra treatment is the patient has to massage the area of treatment, i.e. the face, if that's where we've injected, quite frequently. We say 5 times a day for 5 minutes for up to 5 weeks. So that's actually a lot of massaging throughout the days. As that product is integrating within the tissues, it needs to be kept apart, or the little particles need to be kept apart by regular massage. And I think that's the way to try to prevent the lumps and nodules. So it's quite a lot of intensive work from a patient's perspective afterwards. Now with JULÄINE, there is no risk of the particles coming together because of these little perfect microspheres that don't attract each other. And so there's very little, if any, risk of inflammation. We know it stimulates pathways to produce collagen and elastin that don't go through the inflammatory pathways. So you don't need to massage. So it's a beautiful treatment for patients that, sure, if they want to massage, they can do, but it's not essential and it's not needed. And that takes a huge burden off the patient. And I think the fact that there's a very much better safety profile from JULÄINE with the elastin Pro technology, and we can reassure our patients that it's okay just to have this product injected and get on with their life.
When do you see the best results?
So the results from both Sculptra and JULÄINE are very slow and progressive, okay? It takes at least 6 weeks for the stimulatory processes to get going, to be starting to produce collagen and elastin, and these changes are happening. And once it gets going, it sort of is quite a steady change, and you'll see changes. So we normally say that probably in the first 6 weeks, we may see very little difference. Some people react much more quickly and we can see changes after a few weeks. But most people, it's a good 6 weeks. And then they start to see the changes to the quality of their skin. Maybe the hydration's better, the elasticity, the firmness, the lifting effect, maybe even the volume effect can slowly come. We know that after each treatment, it can be reaching its maximum potential at about 3 to 4 months. If we're doing a course of treatment, then it may be we're seeing those really good results after 6 or even 9 months.
How long can I expect to see results last?
So both Sculptra and JULÄINE are really long-lasting products. They, on average, takes several years for the product to slowly break down. And so both of these products are delivering small amounts of lactate into the tissues to regenerate the tissues, as we've said. And it can be several years before they find that process stops. So we see results for several years in most patients. Now, the aging process can still happen, and you know, it's 2 years in a 50 or a 60-year-old, there will be some natural loss of collagen through the aging process. So the result might start to deteriorate a little bit, perhaps in the second year, but it's very easy to reboot that and get it going again by having a maintenance treatment, say once a year, with these products, and with a small amount. In younger patients, then we see a lot of new collagen being produced, and that actually they are not losing collagen at the same rate as, say, an older patient. So therefore, the results may last longer than several years, maybe 3-4 years. We can see those products giving a really good result.
Sculptra has been around for over a decade now and JULÄINE for just over a year. Why has there been an increasing demand of these treatments?
So I've been using Sculptra for over a decade. It was one of the first products I started using, maybe even 15 years ago now, because it's a truly regenerative product. It does stimulate the production of healthy new collagen. Okay, so we're addressing the skin aging, we're slowing down the aging process, we're improving, but we know it can also stimulate fat and muscle, so we can actually help if we want to put some volume into the face, as well as improving the skin quality and lifting and tightening. So Sculptra, as I say, has been around for a very long time. It sort of, in a lot of places, lost favor because it was a more challenging product to inject. It needed all of the aftercare and the massaging, and so for a lot of patients were put off by that, and they maybe went for a quick fix, which would have been your traditional hyaluronic acid fillers. And we've seen those used hugely over the last 10 years, and often patients have been having a large amount of hyaluronic acid fillers in their faces, and we know that that actually changes the tissue, the nature of the tissues in the faces. So we're now seeing the long-term effects, negative effects of fillers in faces, and this often called overfilled facial syndrome, where the faces start to distort and change, and we're not getting those changes in a positive way in terms of reversing skin aging with a filler. So there's a move away from these products, okay, and there's been a much more interest in more natural regenerative type treatments, of which clearly Sculptra and JULÄINE are. And these are products that can reverse the aging process, maintain healthy collagen, slow down the aging process, but more importantly, bring the right collagen back into the tissues. The nice, soft, elastic collagen, which is what we want. Not stiffness, not lumps, not bumps, not distorted faces. And so people are looking for these more natural regenerative treatments. And they're looking for long-acting treatments. So there's lots of biostimulatory treatments out there which are quite short-acting, like polynucleotides or PRP or these sort of skin boosters that can be effective, but for short term. And so people are looking for these long-term results, which we get with these products. JULÄINE I've been using for a year. Okay, and again, this is proving to be very, very exciting. So there's a long history of these products in the regenerative medicine. I think regenerative medicine, certainly regenerative aesthetics, has become very popular now for the reasons I've said.
What experience do you have in both of these products?
So with both Sculptra and more recently JULÄINE, so as I say, I've had a long history going back 15 years using Sculptra, and I've had many, many patients over that time. We've had some very positive results with Sculptra. I've been using it less now. We have JULÄINE of Sweden, and there's a reason for that, because I was the first doctor to start using JULÄINE in the UK. I was asked to start using it to get experience with it, and we've treated over 300 treatments now with JULÄINE very successfully in the last year. And we tend to use JULÄINE now more over than we're using Sculptra. Why? Because we can use it in all the areas on the face where we may not want to use Sculptra, we may not want to risk the nodules or lumps or stiffness in the tissues that we can get sometimes with Sculptra. And I think from a patient user friendliness, with the need not to massage or the worry about getting lumps or bumps means that patients sort of prefer to use JULÄINE. And I think we'll see more and more people wanting to have JULÄINE. Certainly in my clinic, it accounts for nearly 50% of all of our injectables in the clinic now, and that includes Botox and fillers and everything else. 50% of what we do is JULÄINE of Sweden. So that says a lot. That's happened in a year, and that's for good reasons, because we have many, many patients who are really, really happy with the natural, long-lasting results that they're getting from this product, and are not experiencing issues or complications.
If I've had Sculptra in the past, can I have JULÄINE?
Sure. You know, if you've had Sculptra in the past, then JULÄINE is something seriously that you could consider having, okay? And for the reasons we've said, that actually if you've had a good result from Sculptra, hopefully you've had no issues or complications like lumps or nodules, but you're looking to maintain the benefits and results that you've had from Sculptra. The choice is you could do Sculptra again, but we offer people now the option to try JULÄINE. And I think the advantage we have with JULÄINE is that they don't have to massage afterwards, which is really makes it a popular product. But equally, we can start treating other areas, such as the delicate areas around the eyes, the lips, the thin skin in the temple, the neck, and other areas of the body, which we can use very safely and happily with JULÄINE without a worry of lumps, bumps, and nodules. These are areas where I would avoid with Sculptra. So we give those additional options to patients. But yes, you can combine it. And there's nothing to even stop you using a combination of Sculptra and JULÄINE if you wanted to. We often combine JULÄINE now with other treatments, whether it's that somebody may have had some hyaluronic acid filler in their face, or they're having regular Botox, or they might want some skin tightening with, say, Morpheus 8 or laser or whatever, then they can work synergistically well with a good collagen stimulator like JULÄINE.